Femi, okay, welcome to the stream. This is how it started.
American aspiration is what drove the women of this nation throughout history to demand equal rights, and the authors of the Bill of Rights to claim freedoms that had rarely been written down before.
US Vice President Kamala Harris on Inauguration Day, so that was where it started. And this is how it's going, the Biden agenda for women. What could the next 4 years be like for women and girls, not just in America, but around the world? That is the focus of our conversation. Really interested in your comments, your ideas. You don't have to be optimistic. You can be skeptical. I expect you to be so. And put your comments right here into the comment section, and you too can be part of today's conversation.
What I'd like to see in terms of support for women and girls from the Biden-Harris administration is really that they honor their commitment to addressing systemic racism in this country. And that means that when a Black woman is murdered at the hands of police for senseless reasons, that we can feel confident and comfortable as a nation that the officers in the case will be brought to justice. I don't believe that we can have a truly robust plan to address equity or inequities amongst women and girls if we do not first address the systemic racism and injustice that exists in this country, and we do not hold the humanity of Black women and girls first.
High expectations for the Biden-Harris administration through the lens of women and girls. I have an expert lineup for you. Hello, Seema. Hello, Fatima. Hello, Dr. Millie. Seema, first of all, introduce yourself to our global audience. It's nice to have you.
Pleased to be here. My name is Seema Jalan. I'm the executive director of the Universal Access Project at the United Nations Foundation, an independent organization based in New York and Washington, D.C. And we focus on U.S. foreign policy and sexual and reproductive health rights and justice.
So nice to have you. Fatima, welcome to the stream. Introduce yourself to our international audience.
So glad to be here. I am Fatima Goss-Graves. I am president and CEO at the National Women's Law Center here in Washington, D.C. And we fight for gender justice in the courts and in public policy and in our culture. We also house and run the Time's Up Legal Defense Fund.
And so good to see Dr. Millie. Dr. Millie is joining us from Uganda. This is a miracle. But nice to see you, because connectivity is always a challenge, and particularly right now. Dr. Millie, introduce yourself to our international audience. What do you do? Why are you important to this conversation?
Very excited to be here. My name is Dr. Millie Kagwa, and I work as the Senior Clinical Advisor at Population Services International, PSI. Based in Kampala, Uganda. I've been working in the reproductive health space for a while, working with women and children with a big interest in sexual reproductive health. And I'm glad to be here to represent the woman who is in Africa, who is in Uganda, who is in the communities that are affected by many of these policies.
Nice to have all of you ladies. First reaction to, it's not even a week yet, of the Biden-Harris administration. Women appointments, flurry of activity, women VP, first one ever. Instant reaction. How is it going for you, Seema? What are you seeing that you want to pick out? Making your eyebrows raise, perhaps?
Well, as a South Asian American woman, I mean, I couldn't be more excited to finally see representation in our highest offices. And, you know, as someone who's worked on U.S. foreign policy and gender equality for 2 decades, it's the most excited I've been. It's the most excited I've seen our advocacy community, because the right people are in the right places to make the right decisions on our issues. And that's where all of our policy starts, is with people. We're past the day of trying to convince our leaders why gender equality, gender justice matters. And now we can actually get to the how-to.
As you were speaking, Seema, Fatima was smiling so broadly. Fatima, what is behind that smile? First impressions, first couple of days, Biden-Harris administration through the lens of women and girls. What did you pick out? What are you seeing?
Listen, there is still a lot of energy and excitement from last Wednesday, where we broke one of the highest barriers in having now Madam VP Kamala Harris in this role. And it will say something about leadership of women and women of color in particular for a very long time, right? And at the same time, part of what all of us do is the work to make sure the agenda comes to life. And I've been excited to see the Biden-Harris administration get to work in a range of ways. Today was a day where they outlined a number of really important race equity initiatives and said that race will be at the center of all of their policy making. We are waiting, though, to see more details about what it is they will do on gender equity, what their theory of the case will be. All of those things will be important going forward.
Dr. Millie, first impressions.
Very exciting to see changes that were unbelievable a couple of years ago. Seeing women already, the Biden administration clearly shows that they value women and they value their input, and they are putting them in the center of their administration. So it's quite exciting for me, who is seated in Africa, who is seated in Uganda, to see this happening, because that means I get excited thinking women and girls in Uganda have a chance to have their voices heard or to have their issues, especially if you have women at the center of administration. If you have them in good places where they can actually be heard, then we have hope, and we're excited to see what happens next.
I'm trying to look at the detail, Fatima and Seema and Dr. Millie. I know that's what you work on. It's not just the headline. So we have the headline, the Biden agenda for women, but the detail. What can you tease out already? Fatima, you start, because so far I'm seeing feel good headlines. Wow, look, that's a woman. And I'm just wondering, where's the policy?
Well, I have to tell you, even before they stepped in on last Wednesday, they announced their plan for COVID relief. And the COVID relief plan is critical right now for women and girls in this country. It's critical around ability to work with safety. It's critical around having unemployment insurance. And it's critical for solving the giant care crisis in this country that has women leaving the workforce in droves. And so that was one thing they did even before they were there. They got that ball rolling.
Yeah. I'm just thinking, Seema, for you, what's the hardcore policy that you're seeing already emerging?
Yeah, well, I think it's still to come. The first step is making it clear that this is a priority. And we saw that this administration, before even taking office, announcing the White House Gender Policy Council. And what's significant about that, other administrations have had a council like that before. What's significant about this one is that it's intersectional, and it actually addresses all of these intersecting issues like racial injustice, like economic insecurity, gender-based violence. And the piece that really caught my eye is that it connects U.S. domestic policy with U.S. foreign policy, right? So it's a whole of government approach. It doesn't put women's issues in a bucket in the corner, which is how we've seen things in the past. And so that's a preview, but in terms of how it's actually going to roll out, are they going to, for example, be unequivocal about their support about sexual and reproductive health and rights in particular, which has been particularly impacted in terms of women, girls, and people of all marginalized identities seeing their healthcare ripped away in the context of the pandemic, or seeing ripped away in the context of the actions of the Trump administration? What we're hoping to see, and where the work will really be, is to not just critically repair and reverse the harm of the Trump administration, but to take proactive steps to really build a foreign policy that is centered in the needs and priorities of girls and women, as Dr. Millie already said.
We have a live audience on YouTube, and they have some comments, some questions that I want to share with you. Guess I'm going to get you to respond to these very quickly. All right. So a lot of people on YouTube are saying, Fatima, I'm going to give this one to you. I feel you can handle this. Women should be grateful. Should be grateful. What's all this gender business?
Right. Well, that's how I have a friend who always reminds me that accountability is love. And so maybe I show gratitude through accountability. I actually think the path to having the Biden-Harris administration be successful is to understand that they should actually put gender justice priorities at the center, that those things are not separate questions.
Seema, I'm going to put this one to you. This one is from KUV. How do you feel about the trans military executive order allowing trans people to serve in the military? That is reversing executive order that former President Trump put into place 4 years ago. So trans people can now
It's
openly serve again.
it's just another example of honoring the human rights that we all have. And so ensuring that each person who wants to serve in the military and can do so in a way that they can fully be themselves is part of each of our human rights. So it's another step in the right direction with more work to do.
Dr. Millie, I'm going to give this one to you. This one is from Tando Makoto. It is hard to move towards equality because many men still hold on to nationalism and sexist cultures and ideas. That is a giant, giant question. But what would be your immediate response, Dr. Millie?
I think that that's the reality on most cases in the ground. We still need to have information out there. It's true. Women still don't have a voice, and in some cases are not, their sexual reproductive rights and even just their rights in general are not respected. So they still work, and I think that's one of the reasons why we're seated on this table, to see how do we get to a level where we can actually address the inequities that exist. How do we get to a point where we have a deliberate understanding that women should not be invited as a second, eventually you think, let's bring the women onto the table, but putting women at the center, helping them to understand that they should be at the center. They should also demand for that. And then they should also be part of the solution, finding their solutions, finding answers to the issues that actually affect them.
If you work in the field of sexual reproductive health and rights, you will be very familiar, particularly internationally, with a phenomenon that happens between a Republican US administration and a Democratic US administration. The policy regarding abortion is very different. The amount of money that is allowed to go internationally to fund organizations that do fund abortion changes from one administration to another administration. It's known as the global gag rule. Here's a little explainer, and then we'll ask about this. Let's have a look.
Imagine you need care. You go to a health center, but it's closed down, or you're denied the service you need. For millions of people seeking health services across the globe, that is the reality. This is largely because of the global gag rule, a politically motivated policy that cuts organizations out of the U.S. global health assistance if they provide abortion or so much as advocate or refer and educate people about abortion, even if organizations use their own funding.
Just looking at my laptop here, new White House Press Secretary Jen Psaki confirms that President Joe Biden's future executive actions include reversing the global gag rule. Dr. Millie, what does that mean for women in Uganda, women in East Africa? What difference will that make?
This is one which is very, very interesting for me. It's amazing how policies at the White House do actually impact women in Africa, in Uganda, and they actually affect that woman in the community. They affect women in terms of what communication she's going to receive. They affect women in terms of what services she can access. And of course, they affect women in terms of what products, what financing is available. And one of the things that is exciting for me is that the US will be rejoining the World Health Organization. As one of the biggest funders for many of the health implementing partners in Uganda, having funding available that addresses sexual reproductive health for women is very key in helping women to be able to meet their needs, not only information needs, but also health services, family planning, and even post-abortion care, and where it is in environments where it is legally acceptable, even safe abortion. You must understand that in most of our governments, some of the laws will not necessarily be accepting for women to actually access, for instance, a safe abortion service. But you have information, doctors have information at their tips, and they can stop women from from even going ahead and doing dangerous procedures to themselves. They can give them access to family planning, which will help reduce that burden of disease that we see when women don't have access to these sexual reproductive health services. So it's interesting that whatever happens in the White House will impact what funding is available and what services are available even to a woman who is in Kampala.
Shannon Kowalski is the Director of Advocacy and Policy at the International Women's Health Coalition. I would love you to listen to what she says, Seema, and then immediately come off the back of it. I'm really intrigued by your response. Here's Shannon.
The Biden administration has an opportunity to advance gender justice globally. First, he needs to undo some of the damage of the Trump era, like walking back the global gag rule and re-engaging with the United Nations and World Health Organization to advance women's rights globally. These steps are in progress, but it's not enough to simply return to the policies of the Obama administration. We expect that Biden will do more, like pushing for an end to restrictions on federal funding for abortion in the US and abroad, and working to decriminalize self-managed abortion. Sexual and reproductive health and rights are not fringe issues. They're critical for the ability of women and girls to be able to control their bodies, their lives, and their futures. We expect the Biden administration will treat them as such.
I couldn't agree more with Shannon's perspective here. You know, the thing about the global gag rule, and Dr. Milley mentioned this as well, is that it was a decision made by a few ideologues in Washington, D.C. over several different administrations, and most recently by the Trump administration. And it impacts untold number of people around the world. In addition to abortion, what it actually does is disqualify the most trusted healthcare providers from receiving U.S. taxpayer support, U.S. taxpayer dollars, foreign assistance, to provide a whole range of critical healthcare. That includes reproductive health, maternal health. It includes HIV/AIDS testing, counseling, and treatment, immunizations, a whole range. And so what we saw is that in certain places, potentially the only area where there might be a healthcare offering, that clinic may shut down because it was disqualified from funding because of the Trump administration and the global gag rule. And in that context, you're losing all of your access to healthcare. So I couldn't agree more that it's a critical and urgent first step that this new administration revoke the global gag rule and work with Congress to make sure that there's a permanent end, so that no future administration can put such a regressive policy back in place. And I will say that, again, this is a moment of learning, and it's a moment of partnership. You know, I think the difference the expectation I have for this administration is that we will go to these tables, whether it's at the United Nations, at global convenings, in our direct conversations with other governments, and go with shoulders down to really learn from each other, learn what priorities are, how the U.S. can unequivocally support these issues, feminist ideas in the country, and make sure that that is where we're investing foreign assistance dollars, so that there's long-standing and enduring change that can't be easily washed away by another regressive administration.
Instant question, instant reaction. Fatima, is President Biden, is he a feminist or is he just surrounded by feminists?
Well, I'm pretty sure I've heard him call himself a feminist and as someone who stands for the full equality, politically and economic of women, which is how I define feminism. If I could go back to the question before, though, on sexual and reproductive health, I will just say that we actually are in a situation where, and this is the space where I might slightly disagree with my panelists, that I don't think that on many different issues, including on sexual and reproductive health, that the Biden administration has a luxury of sort of thinking of, well, first I'll do this, and then down the line I'll get to something else. Over the last 4 years, the Trump administration accelerated attacks on access to abortion care. At the same time, states were accelerating attacks in this country. And what it means is already poor access has gotten worse. And so we need more than just one or two things. We actually need them to make it a meaningful priority, to be unequivocal in support, and not only undo the range of things the Trump administration did, but launch forward to improve access to care, no matter where you live and no matter what you make.
What I am wondering, Guess, is what we're talking about, and it's so early days, so it may be a little bit too early to even think about this, but are we talking about more symbolism than substance, or does symbolism have its own power? I'm just going to go around you very quickly because I want to do one more place to visit and one more voice to bring in before we wrap up the show. Seema, symbolism, substance, where are we right now?
The symbolism matters. It matters because the U.S. has an outsized impact around the world. What it says and does on the global stage is heard by millions of people around the world. Other governments, we saw that when we had a destructive government led by the Trump administration, that it provided more attention to other country government leaders who are against essential human rights. And so we need the Biden administration and all of its spokespersons at the State Department and elsewhere to be unequivocal and clear that we are a country and a government that supports these issues, full range of human rights, sexual and reproductive health and rights, and gender equality. However, symbolism is clearly not enough. And I couldn't agree with Fatima more that you can walk and chew gum at the same time. We need to just immediately walk away from the Trump administration policies. But the thing is, the Trump administration policies will take years to reverse, and we can't lose
Seema,
our eye.
I've got to share the last 2 minutes with your co-panelists. So do excuse me for jumping off you and jumping onto Fatima. Symbolism or substance?
I'll just say both. We need the bully pulpit now more than ever to go against the attacks that have in part been cultural. But the policies that are right now undermining access to abortion care, access to contraception, making religious employers allowing religious employers to deny access to abortion care, those need action too.
Yeah. Dr. Millie, are you seeing substantive change in 6 days?
No, that's definitely not possible. I think it needs both. And they're weighed differently at different times. You know, the symbolism right now is really good, getting morale out there and setting the stage. But then at one point, this action needs to be taken. And that action is what really does impact many of the people who are in Africa. The substance, the symbolism needs to go to the extra mile so that we are able to see that they meant business. They were not just creating a visual, but they actually meant business.
This show has been about the Biden-Harris administration and the impact they may well be having on women and girls, not just in America, but around the world. I am going to leave the last word of this conversation to the little girls because they haven't had much of a input so far, but they are our future. Have a look at this. Have a listen.
Dear Kamala.
Dear Kamala Harris.
Dear Miss Harris.
Is it hard doing all that work? I have been waiting for get this, I have been waiting for a girl vice president
Since forever.
I am so glad you are the first.
Because now girls can do anything. From Amelia Phillips.
And she is a Girl Scout. And of course she is, because Amelia is an incredible young leader. Thank you, Amelia.
And thank you, YouTube commentators, and thank you, guests. Really appreciate you. I'm Femi OK. I'll see you next time.